From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
Still ahead for you live this morning. When it comes to treating cancer, more patients are turning to alternative therapies. How well do they work? We'll get some valuable perspective from Dr. Anu Gupta. All right, Jamie, thanks so much. Coming up on quarter till the hour. When it comes to treating cancer, patients often have choices, and not all of them involve radiation and chemotherapy. More Americans living with cancer are using what are called complementary and alternative medical treatments. Joining us now live this morning to explain those treatments and the benefits that can accrue from them is a frequent contributor here live this morning, radiologist Dr. Anu Gupta. Good to have you here, Dr. Gupta.
Thank you.
Treating cancer for a lot of people meant either radiation or chemotherapy, or more likely a combination of the two of them. We have widened those definitions now, and mainstream medicine is a good deal more accepting of these alternative treatments. How well do they work?
So when we talk about alternative therapies, we're talking about things like acupuncture, chiropractic, herbal medications. And acupuncture, we know for a fact, actually does seem to work well for pain relief, for nausea, for some of the other side effects that are associated, especially with chemotherapy. And chiropractic is good also for pain relief on occasion. More importantly, I think, is the alternative therapies that include herbal medications, the shark cartilages and all that type of stuff. Frankly, as people like to believe that standard physicians, people like myself, don't like to engage in those kind of discussions. The fact is there's actually been very limited evidence to prove that any of those things actually work, first of all. And I think as traditional medicine has looked at these things in a very scientific approach, we've actually been able to show that most of these things really don't work despite their claims. The other thing that I think that's important is a lot of patients have this discussion a lot with patients with regards to herbal medications, and that it's natural and it doesn't have side effects. And one thing to keep in mind, there are a lot of things in nature that aren't good for you. Snake venom would be one of them, right? Yeah. It's very important that if, as a cancer patient, you are using any of these things, that your physicians know, because some of them actually will interact with your chemotherapy and your radiation treatments and may complicate your surgery. So a lot of patients like to do this because they feel like they're actively doing something themselves.
There's always the feeling of helplessness, and anything I can do to be a little bit more engaged is a good thing. And it may very well be for the well-being of the patient to feel a part of all that. It's something that doctors do anyway for the most part, but this is a widely held perception. But you've hit the key here, and that is the importance of the dialogue between the patient and the physician to find out what that person really is taking, because the interaction can be a real issue. Especially
when you're talking about treatments that will potentially compromise your immune system, such as chemotherapy. Some of these alternative therapies actually have bacteria and funguses and things like that in them that may put you at risk for infection. So we in traditional medicine have no problems with any of these things, but it's very important you let us know that you're using them. Dr. Anu Gupta is a radiation oncologist and is someone who has a really good feel for what's going on, not just in her specialty, but in others, and that's why her perspective on this is so very valuable, and we appreciate it. Thank you, Doctor.